So, what are the unique concerns regarding bone health that both people who are going through cancer and survivors of cancer have that we need to really deal with?
Well, there's quite a number of things. First of all, if you just think about the age demographic of cancer patients, it's mostly people over 50. Unfortunately, because of our very toxic environment, we're seeing younger people be diagnosed with cancer. I have many more people in their 30s and 40s in my practice now than I used to.
Mhm.
But really, the statistics are that as we age, because we've lived on the planet long enough and we've been exposed to multiple environmental stressors and life that our immune system ages with us. And so we are less able to solve problems and challenges in our bodies as we age. And so most cancer diagnoses occur over the age of 50, which is also the age where women are going through menopause. And also men have bone loss as they age as well. So the bones become less dense and more porous, and so they can be more easily invaded by cancer cells. So there are a couple of cancers that readily invade the bone. Breast cancer is one of them. And so we are simply more, our bones are more vulnerable. At the same time, the things that we need to do to have healthy bones support our cardiovascular health and our endocrine hormonal health. So when you are thinking about what's going to make my bones healthier, it's a bigger impact if you get more exercise and more sleep and eat more protein and get more minerals. A lot of other things are going to improve in your health as well. So age-related bone loss is common to all of us, as is loss of muscle mass. And so a lot of these things go together with just why are we so much more vulnerable as we age? But as women go through menopause and as estrogen declines, and in men as testosterone declines, then minerals tend to leave the bone. So we need to oppose that because human lifespan historically was most people live to about 35 years old historically in early human life. And so now we expect to live to close to 100 in the modern world if you have the privilege of access to good nutrition and medical care. And so we really have to have a plan to take care of our bones for our whole life. And so hormonal changes are a big impact. And in the modern world, a lot of medications also cause bone loss. So there's a lot of factors that cause us to lose bone mass. And you want to really be sure you're not near fracture risk. That's really the goal. Everyone over 50 is going to lose some bone mass. So we want to make sure that we have enough healthy bone that we aren't at fracture risk. So I encourage anyone over 50 to have a bone density scan, which is called a DEXA, DEXA. I'm sure you talked about it on this show since it's focused on bones. So that's not a lot of radiation. It takes about 20 minutes to have a DEXA scan. And so then you get a baseline around age 50 of where your bones are. And then you can, every 2 years, have another scan. And then you get a sense of progression or stability in your bone mass. Some people will have bone loss earlier in life, like if you've had an eating disorder when you were younger, then you might have lost bone mass and not even know it. And so I recommend around age 50, have a bone density scan. It's good also before starting cancer treatments because some of the cancer treatments actually inhibit uh, bone density or decrease bone density. So if you are a breast cancer patient and you receive hormonal blockade therapy, estrogen blockade therapy, if you're a man with prostate cancer and you receive uh, endocrine or hormonal blockade therapy, you're going to lose minerals out of your bones. So you need to monitor that so you're sure you're not near fracture risk. There's a lot of things one can do, which we're going to talk about, but you have to monitor it. It's very important. So there's the DEXA scan, but there's also a test that measures in your urine if you're excreting bone minerals into the urine, and that's called N-telopeptide. And it's really just looking at the bone breakdown products that are excreted in the urine. So if you get a snapshot from a DEXA and you have the entelopeptide urine test, which tells you living physiology, then you have a good idea what's going on with your bone. So it's very, very important. So cancer treatments themselves can uh, uh, oppose healthy bone, but at the same time, cancer patients can be very fatigued and not get enough exercise because they don't feel well. So we know that weight bearing exercise is crucial. So a lot of cancer patients will just be too sedentary. And we know that research shows that patients who do a minimum of 30 minutes a day of just moderate exercise, like a walk, actually have better survival. So it's not only good for your bones, but actually for cancer survival. And then, of course, going out and taking a walk or, even getting on an elliptical or a treadmill will also improve your mood. And then you're more motivated to take care of yourself. And the other thing that happens to cancer patients, because their digestive tracts are affected, or they might have sores in their mouth, or they might have pain when they eat, or they may have side effects like severe diarrhea from chemotherapy. They just don't feel like eating, or they're too tired to prepare food. Then their nutritional status is also impacted. So there's a lot of reasons why the bones can be compromised when we're in the face of cancer.